This presentation will be about Kounis syndrome. We will focus on 5 main topics, such as what the syndrome is, what occurs in someone that has Kounis syndrome, why the condition is of importance, and the diagnosis and treatments associated with Kounis syndrome. Kounis syndrome is also known as acute coronary syndrome because it typically affects the coronary arteries. Kounis syndrome is subsequent occurrence of cardiovascular disease symptoms, such as chest pains, also known as angina, shortness of breath, high blood pressure, and anaphylaxis. All of the previous symptoms mentioned are due to a severe allergic reaction. Kounis syndrome results from intense immune response to allergens. Mast cells are immune cells that become activated and release histamines and cytokines, which cause inflammation of blood vessels. Histamine also activates the platelet activating factor, causing more inflammation and the aggregation of platelets. These substances work together to cause constriction and rupture of blood vessels, typically the coronary arteries. There are 3 types of Kounis syndrome. The first involves the constriction of the coronary artery or vasospasm in individuals without underlying health conditions. The second involves people with pre-existing conditions. And the third is characterized by the formation of a blood clot within the blood vessel, also known as a thrombosis. There are many risk factors associated with Kounis syndrome, but the 3 main ones are smoking, high cholesterol, and high blood pressure. Kounis syndrome is important because despite what statistics suggest, it is not uncommon. However, the reason for this is because it often goes undiagnosed because people do not associate cardiovascular disease with allergen exposure. Did you know that there are more than 2.6 million Canadians with allergies? Diagnosis includes the following: a history of allergy attacks, symptoms of cardiovascular diseases such as chest pain, difficulty breathing, and sweating, an ECG to mainly observe for the presence of an elevated ST segment, and a blood test to see if elevated white blood cells and histamine are present. To treat Kounis syndrome, firstly, anaphylaxis is to be treated with antihistamines and corticosteroids to reduce inflammation and the release of mast cells. After the heart medications are used, such as vasodilators like nitroglycerin, which treat angina and narrowing of the arteries, and aspirin to cause blood thinning. Surgery to input stents may also be necessary if the blockage is too severe. Thank you for watching.